Assalamualaikum everyone, welcome back to our lectures. So this is me Alia Waheed and you are on the channel of Medicare. So as you know that we are starting our new year of pharmacy, which is the third year, and we are starting another very beautiful subject, and this is about the pathology. So this is the channel where you find every subject of every year of pharmacy. You can find the every detail and every subject will be available here. So you can subscribe to my channel and you press the bell icon so that you can receive every new lecture that can really help you. So as now we are going to start our lecture. So as you know that we are going to study the introduction of our pathology. So before introducing is I'm going to give a detail of pathology, that what it is and what kind of things we are going to study it. Then after that we will start the introduction of it. So as you know the pathology, what is this word and what are we are going to study in it. So it is from two words, patho and logi. The words patho mean a disease or a suffering. Okay, so anything from which you are suffering from is called patho, and it is called, and this kind of disease is caused by an agent which is called as pathogen. Okay, and what is mean by logi? Logi always mean to study. So this is a subject where we study about a disease. Okay, so the word patho mean a disease, any kind of disease, and logo mean to study. So you are going to study about the diseases and why we are studying the pathology, why we are studying the diseases in the form D. So actually in the form D you have to prepare the medicine against a particular disease. Okay, so if you don't know about the disease, how you can prepare the medicine? Okay, so to kill that particular pathogen, to kill that the disease causing agent which present inside the patient body, to kill it you know about that disease, you should know about that disease causing agent, you should know it, and then after that you make the medicine against it, that how you kill that particular pathogen, and after that you are ready to dispense that medicine to that disease person. So this is the importance of pathology. So this is, so the word pathology definition is that you are going to scientifically study the disease knowledge. So as we have explained the disease, so what it is disease? Actually, what is mean by a disease? What it is? Can you have any guess? Yeah. So disease is something which is the abnormality in your body. So this is any kind of abnormality inside your body. Okay, so whenever any kind of changes, any kind of abnormality occurs in your body, you suffer a situation which is called as a disease. So what happens in the abnormality? What happens in it? Actually, the three kind of changes occurs in your body. Okay, whenever a disease occur, three types of changes occur. First change occur in the anatomical features. Anatomical, they will change, and how they change I explain to you. Second thing that change is your physiological function. Your normal body physiology will change because of that disease causing agent. Physiological functions will change, and the third thing that will change itself after a disease is the biochemical activities. All the biochemical activities that occurs inside your body will change. Why they are changing, or how they change? The first is the anatomical features. You have seen any kind of person whose head becomes very large after some time, and can you see a person who have very large hands and very large feet? this is the anatomical features changing. So her anatomical positions, anatomical the bone structure and your muscle structure, they change itself, and that's why you feel that person any kind of abnormality in it. Second abnormality that can occur when you have a disease is a physiological. Yeah, like your normal body physiological, like if I give you the example of blood pressure. So your normal blood pressure is 120 over 80, but whenever a disease occur, your blood pressure increases. Whenever in your fever, whenever you have some kind of disease, your blood pressure can increase or can decrease. So this is a physiological change in your body. And the biochemical activities change is like your pH disturb itself. Okay, your pH, you have acidity, you can have basicity. Your glucose levels can also change in your body, like high glucose level and low glucose level. So these kind of biochemical activities can change itself when you have a disease. So now this whole will become the definition of the a disease. You cannot only define a disease is like abnormality in the body. Okay, so whenever someone asks you that what is a disease, so you can't define it in a single way that it is the abnormality in the body. No, you have to properly define it like disease is the abnormality in the body, in the anatomical features, physiological functions and the biochemical activity of the body. So this is the abnormality that change our anatomical features, that change our physiological functions, and that also disturb our biochemical activities. And I have give the examples of examples of it to you so that you can easily understand it. So now we have studied what is a pathology, what is a disease. Now we are moving to the next thing, that are some kind of terminologies that will use in the pathology, and you have to know what it is. Okay, someone, if you ask someone tell you these terminologies or ask you about it, so you have to know that what are they. Okay, so the first terminology that used in the pathology is the word etiology. What it is? So sorry, it is etiology. So this is the first terminology. What is the etiology? Actually it is the study of the cause of a disease. अगर आप किसी disease का cause study कर रहे हैं, the causative agent of a disease, cause of disease. Like if I give you the example, like if we are studying the cause of the corona, you know very well that the cause of a corona disease is a virus which is called as COVID-19 or coronavirus. Okay, so this is the particular cause of that disease, so we say it etiology. The next terminology that can occur is our pathogenesis. What it is? Pathogenesis. Patho mean disease and genesis mean the origin, the development of a disease. Okay, so genesis actually mean origin. What is the origin of your disease? Okay, and it also mean what is the mechanism of action of your disease. Mechanism of action. Okay, how your disease is processing, what is the mechanism, how it disturbs your anatomical features, your physiological functions and your biochemical activities, how it is acting it. So this will study under the pathogenesis. The next term that we are going to study is about the diagnosis. You all know what is mean by diagnosis. Yes, am I right or not? You know about it? Yeah, everyone knows the diagnosis mean to investigate a disease. Okay, to identify a disease. Investigation. We are going to investigate whether this person has this disease or not. Okay, so after that we diagnose two types of things in a person. Okay, whenever any kind of disease occurs, we diagnose two things. What two things we diagnose? Okay, so the first thing that we diagnose in a person is percentage is the percentage of our diseased person, the person which are suffering from a particular disease. Like if I have say that the percentage of diseased person suffering from the corona is like 75%. Okay, so whenever there is a pandemic of corona everywhere, so every time when you open the news channels, they are showing the percentages. Okay, they are showing like this amount of persons are suffering from that disease, and this amount of the person are are died due to the coronavirus. So okay, so these kind of percentage occurs. So if someone tells you about the percentage of diseased person, this is called as morbidity of a disease. Morbidity of that particular disease. So if I have tell you that 75% of that patient is suffering from the coronavirus, so it means I have tell you about the morbidity of coronavirus. Okay, and the second thing we diagnosed in a particular disease is the percentage of death person, percentage of died death persons which undergo the death due to that disease. Like if I say the percentage of death person in the case of coronavirus is very high, because a lot of people in worldwide are die due to this virus. So this is called as mortality of a disease. Mortality of that disease. So in news channel, whenever they have said that this much of patient died due to the coronavirus, so they are telling you that mortality of the coronavirus, that the coronavirus, due to coronavirus, this amount of people die due to this disease. So this was some terminologies that are very very important, and they are can be telling you. Yeah, so two more very important words that use after and after in the pathology, and these two words are related to it, so I am explaining them. Yeah, so the first word that related to it is biopsy. Biopsy, what it is, any idea? Okay, so biopsy is something that you have take a tissue from a living person and we are going to investigate. Okay, from a living disease person. मैंने एक डिजीज़ पर्सन से एक टिश्यू लिया क्योंकि मैं उसके ऊपर इन्वेस्टिगेट करना चाहती हूँ, मैंने उसकी डिज़ीज़ कॉजिंग एजेंट पे काम करना है, तो मैं वो टिश्यू लिया और उस पर मैंने इन्वेस्टिगेट किया, इट्स मीन मैंने उसकी बायोप्सी की है. ठीक है. दूसरी चीज़ आ जाती है एटॉप्सी. व्हाट इट इज़? एटॉप्सी. एटॉप्सी मीन टू टेक द टिश्यू फ्रॉम अ डाइड बॉडी. ठीक है. अब मैं डिजीज़ पर्सन से नहीं लूँगी, मैं अपने जो डेथ पर्सन है जिनकी मॉर्टेलिटी हमें बताई गई है, मैं यहाँ से अगर मैं टिश्यू लूँ और मैं स्टडी करना चाहूँ कि क्या हुआ उस पर्सन की बॉडी में, कि वो मर गया, वो डाई हो गया, तो उस चीज़ को मैं एटॉप्सी कहूँगी. ठीक है. तो ये दो टर्म्स थी विच आई वांट दैट आई एम टेलिंग यू. ओके. So after that we have study about our pathology, we have study what is the disease, what happened in it, we have studied some terminologies that are related to pathology. Now I am damn sure whenever someone say question about the etiology, you know what it is. Whenever someone say what is the morbidity, you can answer them. What is mortality, what is biopsy, what is autopsy. I have explained every term related to it, and I am damn sure that you have understand it very well. And after that we are going to study the types of pathology. Okay, so now we are going to discuss that what are the types of pathology. So there are two main types of pathology. The first is the general pathology, and the second is the systematic pathology. Okay, so what are them? We are going to explain it. What are them? So first is the general pathology. So this is the study. Okay, pathology means to study a disease. So in this we also study a disease, but we are studying the disease at the cellular or tissue level. Yani we are studying a disease but only in tissues or in the cell. Okay, you will take the cell or tissue from a diseased person or from a die person. You are studying that disease through the cell or tissue. This is called as the general pathology. If I give you the example of it, like we are studying the inflammation in a blood vessel. In the blood vessel is represented by BB. So whenever the inflammation occur in the blood vessel, its tissue, its cell, we are studying that how the inflammation occur in the cell of blood vessel. This is called as general pathology. I hope you understand it. Okay, so after that we study what is the systematic pathology. So this is the study of disease at the organ or systematic level, at the organ system level. Our body has a lot of organ system like the GIT system. So if I am studying the pathology in the GIT, like GIT pathology, so I am studying that in our whole GIT tract some disease occur in it. So I am considering the whole organ system, the whole organ. I am not only discussing a particular organ. I am studying the whole organ system, a whole system, and how the whole system, whole GIT is affected by a disease. I am studying it. So this will come under our systematic pathology. So now I hope that you understand it. Another examples of the general pathology is like heart pathology. You are studying the heart, it's the heart pathology. You are studying the liver pathology, you are studying cardiovascular pathology, you can. So you are studying a full whole organ system. So this systematic knowledge is called as systematic pathology. So I hope that you will understand all the major types of the pathology. Now after that we are going to study some minor types of the pathology, and they are I am going to show you. These two types are the major, but some minor types of pathology are given below, which are like hematopathology. So as its word indicate, pathology means studying a disease. Hemato means blood. Means you are going to study about the diseases related to the blood. Okay, so what kind of diseases related to blood are? An example you can have in your mind? Okay. I am telling you, like the first example is anemia. Anemia is a disease in which you have reduced red blood cell. Am I right? Yes. So this is a disease of blood? Yes. And we are studying that particular kind of disease. We are studying about anemia. It comes under the hematopathology. Very good. Now we study leukemia. It's a white blood cell disorder. Am I right? Yes. So we are studying about the blood and its diseases. So this comes under the hematopathology. The next type of pathology is the immunopathology. I'm not repeating the word pathology, you will add it. So immunopathology means we are studying the diseases which occur in our immune system. So it actually comes under the systematic pathology. Okay, so like the autoimmune disorders occurs, a lot of autoimmune disorders, you know about what are them. So autoimmune disorders occurs in your body, like the hypersensitivity is very good example of it, and a lot of autoimmune disorders occurs in your body. Okay, you can add the example of them. Okay, so the next type of pathology is the forensic pathology. What it is? The third type is forensic pathology. To determine the cause of death. What is the cause? Why it occurs? It's called as cause of a disease. आप डिटरमाइन करेंगे कि कौन सी कॉज है आखिर, ठीक है. इसको हम एटियोलॉजी भी कहेंगे क्योंकि हम एटियोलॉजी में डिज़ीज़ की कॉज स्टडी करते हैं. सो फोरेंसिक मीन एक डाइड बॉडी है, वो मर चुका है और अब आपने उसका पोस्टमार्टम किया और आप देखना चाहते हैं कि कौन सी बीमारी हुई, कौन सा वो डिज़ीज़ कॉजिंग एजेंट था जिसकी वजह से डेथ हुई. लाइक इफ़ वी डिस्कस द केस ऑफ द कोरोना वायरस, सो अ लॉट ऑफ पेशेंट डाइड ड्यू टू दैट वायरस. सो इफ़ वी आर गोइंग टू स्टडी that particular reason, we are going to study the coronavirus, what it is, we are studying the cause of it. So this is called as the forensic pathology. Very good. The next is the histopathology. Histo always came under the histology. Okay, but it's the histo and pathology. Histo mean histology. Histo mean always mean tissue, study of the tissues. Okay, so always you are going to study about the diseases that came in our tissues. You can study it under the microscope. This is called a histopathology. So the other types of pathology we discuss it. Okay, so these are some remaining types of the pathology. These are cytopathology. Cyto word means cell and patho mean to study a disease. So cytopathology mean to study the disease at the cellular level. Okay, so it comes under the general pathology. Clinical pathology mean lab analysis of the body fluids. Okay, if you are going to analyze a body fluid like our blood, like our urine and the other body fluids, you are going to do the clinical pathology. Next is the molecular pathology, study of disease at the molecular level, not cellular level, not tissue level. We are discussing the pathology at the molecules level. We study any kind of molecule study present in our body, and we study it, that how this molecule is causing a disease. This is called as molecular pathology. Surgical pathology, it's mean to study a tissue removed during a surgery. आप किसी भी पेशेंट की सर्जरी करें और उसका कोई भी टिश्यू रिमूव करके आप उसके ऊपर स्टडी करते हैं कि उसके अंदर डिजीज़ कैसे हुई, तो उसे सर्जिकल पैथोलॉजी कहेंगे. एक्सपेरिमेंटल पैथोलॉजी मीन रिसर्चिंग द मैकेनिज्म ऑफ एक्शन ऑफ अ डिजीज़ थ्रू एक्सपेरिमेंट. आप एक्सपेरिमेंट करते हैं और उसके बाद देखते हैं कि आपकी डिजीज़ का मैकेनिज्म ऑफ एक्शन क्या था और किस तरह से ये चीज़ हुई है. ठीक है, सो वी हैव कवर्ड ऑलमोस्ट ऑल द इम्पोर्टेंट थिंग्स अबाउट द पैथोलॉजी. Yeah, so the last thing that remains is our scope of pathology. Scope of pathology is not very important for the paper point of view. Yeah, that's just important for your viva. Okay, so what is the pathology? So I am going to explain you that is to study the disease and their effect on your human body. So this is the major purpose of your pathology. So it's very helpful for identify or diagnosing a particular kind of disease. So whenever you have to diagnose that this patient has or not, whenever you are identifying or investigation a disease, so this will help you. It deals with the inflammation, necrosis and healing process inside your body. So how the inflammation occurs, how the infection occurs. Okay, so do you know what is the difference between the inflammation and the infection? You know about it? Okay, so I am telling you what's the difference is. I'm not writing it, so you have to listen it. So the major difference between an infection and inflammation is that infection is due to the invasion and the entry of multiple pathogens which cause a disease. अगर आपकी बॉडी में बहुत सारे पैथोजन सेंटर हो जाएं और एक डिजीज़ कॉज करें, इसे इन्फेक्शन कहते हैं. What is inflammation? It is the body protective response to a injury or a infection. कि जब भी आपकी बॉडी में इंजरी होती है, कोई भी इन्फेक्शन होता है, उसके बदले में जो बॉडी एक प्रोटेक्टिव रिस्पॉन्स करती है उसे इन्फ्लेमेशन कहते हैं। अब आपको मेजर डिफरेंस पता लगा होगा। अगर हम देखें इन्फेक्शन तो वो काज होता है माइक्रोब्स की वजह से, और अगर हम देखें इन्फ्लेमेशन तो वो काज होता है किसी भी इन्फेक्शन की वजह से, किसी भी इंजरी की वजह से, किसी भी टॉक्सिन्स या इरिटेंट्स की वजह से। सिम्टम्स अगर हम बात करें तो इन्फेक्शन में आपके सिम्टम्स होते हैं जैसे फीवर हो जाता है, फटीग है, पेन हो जाता है। इन्फ्लेमेशन में भी पेन होता है लेकिन साथ रेडनेस होती है, स्वेलिंग होती है अगर आपने नोट किया हुआ, और हीलिंग का प्रोसेस जो है उसमें स्टार्ट हो जाता है। ड्यूरेशन की बात करें तो इन्फ्लेमेशन आपका एक्यूट भी होता है, क्रॉनिक भी होता है, और अगर हम इन्फेक्शन की बात करें तो वो जब तक पैथोजन आपकी बॉडी में रहता है आपका इन्फेक्शन भी रहता है। ट्रीटमेंट की बात करें तो हम इन्फेक्शन को ट्रीट करते हैं एंटीबायोटिक दे के, एंटी माइक्रोबियल ड्रग्स दे के, जबकि इन्फ्लेमेशन ट्रीट होती है नॉन स्टेरॉयडल एंटी इन्फ्लेमेटरी ड्रग से। एग्ज़ाम्पल की बात करते हैं तो इन्फेक्शन की एग्ज़ाम्पल ये है कि आपको नमूनिया हुआ और वो नमूनिया किसी एक बैक्टीरिया की वजह से हुआ जो लंग्स में इन्फेक्शन कॉज करता है, लेकिन इसकी बजाय अगर हम इन्फ्लेमेशन की एग्ज़ाम्पल देखें तो उसकी एग्ज़ाम्पल आ जाती है आर्थराइटिस की। आर्थराइटिस क्या है? इन्फ्लेमेशन इन द जॉइंट्स। So this is the major difference in the infection and the inflammation. Now if anyone tells you that what is the difference, if anyone asks you this question in the viva, you can answer them very efficiently that the infection occurs when the microbes enter your body, while the inflammation is the body protective response that occur after a infection. Their symptoms, you know, their cause, you know about it, you should know their example, and you should know their treatment. Okay, so the next thing is that the scope of pathology is it's deal with the cardiovascular and GIT pathology. It's a very play important role to study the microbes and their role in causing a particular disease, and it's very important to make a medicine. So this is the importance of a pathology. This is the scope of pathology. I hope that you will like this video, and if you like this video, please subscribe to my channel, and if you find this video helpful, then please share it with your friends, and take care. Allah Hafiz, and meet you soon in the next lecture. Till up, Allah Hafiz.